When IVF first developed, fresh transfers were the only option. But with the advent of cryopreservation, that is freezing the embryos, frozen embryo transfers have become a common practice nowadays. There are few centers across the world wherein they practice only freeze-all policy, wherein only frozen embryo transfers are done, wherein no fresh transfers are done. So basically, fresh transfer is nothing but doing an oocyte retrieval in an IVF and transferring the embryos back into the uterus 3 to 5 days after the retrieval. But in a frozen embryo transfer, the oocyte retrieval is done and then the embryos are cryopreserved, that is, they are frozen, and the embryos are transferred back into the uterus, say in the next month or a couple of months later. Frozen embryo transfers are indicated in a couple of situations wherein fresh embryo transfers are contraindicated. This happens especially in a cycle wherein there is a risk of hyperstimulation. So that is risk of OHSS. The frozen embryo transfers are preferred over fresh transfers, and also when the progesterone levels are high, frozen embryo transfers are preferred. And also when a couple needs to go ahead with PGT, frozen embryo transfer is the preferred option. And for women who have got pregnant in the first IVF but will want to go ahead with the second pregnancy, then the frozen embryo transfers are helpful. And also for women who wish to preserve their embryos in view of the age, or if detected with cancers, frozen embryo transfers are the preferred procedures. So when it comes to whether to say frozen embryo transfers are better than the fresh embryo transfers, statistically the outcomes are the same. But few clinicians prefer to do frozen embryo transfers because they're of the opinion that transferring the embryos in a natural hormonal environment of the uterus, the implantation is better and the outcomes are better. But the decision of doing a frozen embryo transfer versus doing a fresh embryo transfers is very subjective. So the decision has to be made on a case-to-case basis clinically.